In 1984, USAID started the Demographic and Health Surveys project. In 1985, data collection began in El Salvador. Throughout the years, more countries were surveyed, different survey types were developed, new technologies used, and more topics covered. In 2009, 25 years, 240 surveys, and 85 countries later, we celebrate the use of DHS data around the world. Data that have supported informed decisions and led to better population and health policies and programs. Data that have helped improve lives.
It's the most powerful development tool available for countries of the third world.
La encuesta es una mina de datos que debe ser explotada por académicos, por instituciones, por tomadores de decisiones.
The letters DHS are actually like a word. People just say the DHS and they know instantly what it is. There's instant recognition.
The National Demographic Survey has been a treasure trove for researchers.
The DHS has helped catapult the world into the modern era of evidence-based policy.
I've seen it make a difference, especially when one is developing programs for interventions. You'll be able to know the gaps and where to target your programs.
DHS's initial mission was to assess change and progress in fertility, family planning, and maternal and child health.
For a story in vaccination, I suddenly had data, the trend data that showed that actually the vaccination rates were improving, confirmation that a lot of the programs in the field were working. That, to me, was an incredible public service.
Es una encuesta que para el país tiene la gran importancia de ser la fuente de información fundamental para hacer seguimiento a todos los indicadores de salud sexual y reproductiva.
The concept of unmet need for family planning matured and evolved in the hands of the DHS. The DHS is the gold standard in monitoring unmet need for family planning.
In recent years, DHS has responded to emerging global needs, collecting data on gender, domestic violence, and malaria.
The DHS, to my knowledge, is the most extensive source of nationally representative population-based data that includes some of the most reputable measures of domestic violence.
DHS information about FGC allowed me to include in my reports more accurate data about what happens in African countries.
DHS surveys provide information on the types of drugs that are used in the treatment of malaria in children. We use this information to convince governments to change their drug policies.
Countries are actually able as part of the DHS to look at parasite prevalence. We're in the process now of working with the government on a national campaign to deliver insecticide-treated nets. And if you look at that map, it's very clear, if you want to have an impact on the burden of malaria, where you should start.
DHS estimates of national HIV prevalence have changed the way the world understands the AIDS epidemic.
The addition in 2001 of HIV testing to these surveys was an important contribution, the results of which have vastly improved the accuracy of national HIV prevalence estimates.
It has given the opportunity to also revise downwards the global level of the epidemic, and this was mostly based on the quality of the information collected through the demographic and health surveys.
It has made a difference, particularly that we have now done the HIV testing for the second time. It will give us an indication on where more programs have to be done at a more intense level, looking at the results that we have gotten from the surveys.
We need to show results, and the surveys help us measure them. They are vital to reach the goal of universal access to HIV prevention, treatment, care, and support.
DHS represents an international standard for quality control and data collection. And after data collection, DHS ensures that users have free access to the data as well as the basic survey tools.
The DHS has really, for me personally, but I also think for the field of global health, transformed the whole arena by first establishing that data should be in the public domain.
It imposed a kind of standard questionnaire. It increased comparability in the analysis, so that what you ask in Sri Lanka, you're asking the same set of questions in Niger.
The DHS data sets are in fact extremely user-friendly and ready to use.
I'm advising people, for example, people in Namibia to use it, and it's also a teaching aid on its own.
With each survey, DHS strives to build the capacity of the host country, leaving behind not only statistics and reports, but a greater ability to collect and use data.
Doing the DHS survey in Turkey helped us to improve the quality of the data that we are collecting and have a better understanding and better implementation of the international standards in collecting data.
They are creating a lot of capacity building within the developing countries. Like myself, I grew with the DHS. It's through the capacity that I got from the macro that I'm here as the Director General of the NBS.
The ultimate goal of the DHS project is to support the use of data to inform policies and programs.
Through DHS, in Bangladesh, we found that there was extremely high inequity in use in all types of maternal health services. So now, interventions are designed to address the need of the poor.
We have what we call the national development plans in the country. There, we use the DHS heavily in terms of informing the policies on health. Without the DHS, we would have serious gaps.
When you see even mayors and governors, local decision makers, NGOs, international community, citing the demographic health survey as the most reliable data that you can get.
Recently, using the maternal health data of DHS, we have planned an intervention for prevention of postpartum hemorrhage, and which I believe would make a lot of difference in maternal mortality.
It's given us tools and the means to have evidence-based decision-making.
For 25 years, DHS data have been an invaluable resource for policymakers, program managers, students, researchers, and international organizations.
Clearly, the countries want these surveys. The countries value the data. They keep coming back and requesting new surveys.
I'd like to thank all the partners who are involved in DHS. It is just a sort of compass for us, where to go and where do we stand.
This entire effort is a triumph of initiative and vision on the part of USAID. It's a triumph of partnership, and really it's a triumph of quality information that feeds decision-making around the world.
Thank you, USAID, and the dozens of other funders who have supported surveys throughout the world. We are grateful to the thousands of people who have worked to collect data, and to the women and men interviewed who have generously given their time. The results of these efforts will continue to be used to improve our world.